Hi everyone, I'm Dr. Faisel Syed,
And I'm Dr. Dan McCarter.
and you're listening to Faisel Friends, where we believe access to primary care is a right, not a privilege. Today, we're talking to Dr. Raziuddin Ali from WellPath about integrated correctional medicine. Let's dive right in. Hey, Dr. Dan, how are you doing?
I'm good. It's great to be here with Razi, and great to be here with you.
Dr. Raziuddin Ali, welcome. It's so nice to meet you, and I've heard wonderful things from Dr. Dan, and it's great to have you.
Thank you, Faisal. It's a pleasure to be here.
I love to hear the physician stories. So I want to know why you became a doctor and the path that you took in life to get to where you are today.
Absolutely. So, I come from a family that's in the healthcare field. My father's a physician, and, we had grown up with the expectation of helping others. And so from a young age, I was interested in healthcare and was a candy striper in high school, became an EMT. And through those early experiences, really solidified my desire to be a physician. And I was lucky enough to be selected into an undergrad and med school program where we did early clinical shadowing in undergrad. And so that was fantastic. And then, I actually, after med school, started out in radiology residency. I was thinking technology, this would be great. I could do it from home. I started the residency and I missed the most critical aspect of medicine, which was that human connection. So after a few months, I told my program director, I said, I don't think this is going to work out. And so I actually transitioned back to internal medicine and did that residency. And that's really where I just found myself. Really enjoyed taking care of individuals holistically. And during residency, was able to participate in a residency fellowship, which was about health policy. And this was just before the ACA. So as part of that, we got to go to the Hill. We got to meet with think tanks. And we really got to see the lay of the land over the next 20 years. And that was value-based care. And to be a part of that, be exposed to it, I thought was phenomenal. And so here I was finishing up residency, and I was like, well, where do I go for value-based care? And at that time, I really didn't know. My wife and I, we were expecting our second child. Our home base was Richmond, Virginia, which is where we had family. So we said, let's go back home. Let's figure things out. And initially, I started out as a hospitalist physician. And while I was there, I learned more about value-based care through Anthem CareMore and learned about how we can take care of Medicare individuals, duals individuals that are Medicare and Medicaid in a value-based way. And that was really appealing. So I made the jump and dove head first and never looked back. And so it was fantastic. So we got to take care of individuals across the continuum of care: hospital, SNF, long-term care, clinic, chronic complex diseases, and the management of that. And I got to elevate into the regional medical director role for that. It was at that time that I really got bit by the bug of how can I help society even more? How can I help among the most vulnerable individuals? And that's when I pivoted towards correctional health. Where I lived, there was a large regional jail that had a poor reputation for the medical care that it provided. And I really felt that if we take care of individuals as they need to be taken care of, at the end of the day, they'll have better outcomes and it can be done for less cost than if we have the fragmented care that we all know in fee for service. And I thought that if I can be a part of that, I can not only help the residents that are just as involved, but I can also help the taxpayers because we're saving taxpayer dollars. And so that's when I made the jump over to correctional health. And let me tell you, correctional health is so primed and ready for integrated value-based care, where we provide not only medical care, but behavioral health, dental, optical care, and serving the most vulnerable individuals. So it's been so rewarding to be a part of that journey. And that's what I've learned. I've learned that I want to be a servant leader, being mission driven, being a part of social justice and racial justice, and being part of the change. And so that's a little bit about my story.
Oh my gosh, that is such an incredible story. So incredibly inspirational, and I mean, you started as a hospitalist. You ended up becoming this full continuity doctor. Taking care of patients when they're in the hospital, the nursing home, the outpatient setting, and then here you are with with one of the most challenging patient populations. I find a lot of similarities. Where I could tell we end up drawing and attracting these kindred spirits, Dr. Dan, don't we? Like we end up meeting these wonderful people who believe in health equity and justice. They're populations of people who require much, much more attention. We can't treat them the same as people who have access or people who have more resources. So I'd like to hear a little bit more about the transition from looking after people outside of the correctional system to moving in. What did you see? What did you know? Because I don't know much about, and I'm sure many people don't know what the reality is that many of the inmates are facing on a day-to-day basis.
Yes, yes. What we see is we see a lot of individuals that have not had care or have had ultra fragmented care up until the point of coming into a jail or prison. And so many of our residents, upwards of 30 to 40%, have a comorbid diagnosis of some behavioral health component, whether it be depression, whether it be bipolar. There's a high preponderance of SMI. And so a lot of what happens in correctional medicine depends on if we are in the jail setting or in the prison setting. The jail setting is where individuals come off of the street and before they actually have a sentence. And so what we see and deal with is a lot of urgent care and ER. So we have individuals that may have long-standing diabetes or hypertension that hasn't been cared for.
Oh, yeah.
So controlling those blood sugars, those blood pressures. We have individuals that have opioid use disorder and maybe withdrawing from opioids. And so we're seeing a lot of that as well as alcohol withdrawal as well. And so it is a very high paced, fast paced arena, at least the jail setting. And then what we do is we work hand in hand with our behavioral therapist, our psychiatrist, as well as our dentist to provide holistic care for these individuals. And then also at the same time, we try to align a pair service for them for when they will leave the correctional setting. So Medicaid and Medicaid expansion has been hugely important during this time for our residents. Um, and then when we go away from the jail side, we then have the prison side. So this is after an individual has been sentenced. And so usually the individual's acute situations have been stabilized, and now we're dealing with chronic medical conditions. So things like COPD, asthma, the diabetes, the hypertension, the heart failure, all those things we are taking care of longitudinally. And so how do we deal with these individuals? How do we take care of them? So many jails and prisons will actually um, contract out a service to provide medical, dental, behavioral health care. That's one option. Or the other option is that the jail or prison will hire directly these services where they actually employ the physician or the dentist and psychiatrist. And so, just like in our outpatient world where we go to see a doctor in the clinic, we have a centralized clinic within jails and prisons where we do everything like we do on the outside. So we have medical assistants, CNAs, checking vitals, having somebody come in for their annual exam. And then we have chronic care follow-ups. That's really based on the cadence is based on the severity of illness. So at minimum, we're seeing individuals twice a year. But if they have poorly controlled diabetes with the A1C above 9, we're seeing them at minimum quarterly. But in all openness, we can see them every week if we want to.